Are you trying to choose between sildenafil, tadalafil, and vardenafil? Well, I own a telehealth company. We offer two of these three medications, and today I'm going to tell you everything you need to know about all three of them, including why we don't offer the one. We're going to talk about price, we're going to talk about duration, we're going to talk about food, everything. Let's go ahead and get right into it. Let me give you a 3-sentence history because this is important. Sildenafil is the active ingredient in Viagra, and it came out in the late 1990s. Tadalafil is the active ingredient in Cialis, and it came out in 2003. And vardenafil is the active ingredient in Levitra, and it also came out in 2003. So if it seems like Viagra was a huge success, and then these other two drug companies came out with kind of their medication that does a very similar thing, that's exactly right. They're all in competition with each other. They all basically do a very similar thing, but differently, and we're going to talk about those differences. And the very first difference that we're going to talk about is timing. All three medications need about 30 to 60 minutes to fully kick in. You should probably plan on taking these about an hour before sex. That's true for all three of them, guys. But the real difference is in timing between how long they last. So sildenafil and vardenafil last about 6 to 8 hours for most men. However, tadalafil, the active ingredient in Cialis, lasts about 36 hours, and that is why Cialis is often known as the weekend pill. So 6 to 8 hours, 36 hours, that's the big difference in timing when it comes to these medications. Now let's talk about how men say these medications make them feel. Now, at my telehealth company, we offer sildenafil and we offer tadalafil, and we have thousands of patients across the country. Now, we have a team of doctors at shamelesscare.com. I am not one of them. What I'm going to tell you today is really important, but it is not medical advice. And that is what people tell us they like about the medications, or if they're switching, why they say they're switching medications. So generally speaking, men say that sildenafil has a very profound, immediate impact. It's really kind of gives you a little punch, gets you going, but it doesn't last very long, lasts about 6 to 8 hours. Men also say that in most cases, tadalafil is a little bit more of a blunted effect, but lasts longer. So if you were looking at these drug curves, it might look like sildenafil is pretty sharp, but doesn't last long. And tadalafil might be a little bit more blunted, but lasts longer. But the truth is, at shamelesscare.com, most men stick with the initial medication that they choose, which tells me that both of these medications work really well for almost everyone. Now let's talk about side effects, because this is where the medications really kind of start to separate. So basically, these medications do something known as inhibiting an enzyme called PDE5. You do not need to remember that. You don't even need to understand what it means. The point here is that's good. That's what you want. That's what helps you get and maintain an erection. But they can also inhibit some other PDE enzymes sort of by accident, in a sense. It's not ideal. It's a side effect. Imagine you're shooting a shotgun and you're trying to hit PDE5. That's what you want, but maybe some pellets also kind of go off and hit some other things that aren't ideal. And that's sort of what's happening here. So sildenafil and vardenafil can both also inhibit PDE6, not intentionally, just happens, and that is an enzyme in your eye. And that is why these medication labels can sometimes talk about blurry vision or tinted vision, and to reach out to your doctor right away if you're experiencing those. That's because of PDE6. Sildenafil and vardenafil both have that issue, although vardenafil does seem to be a little bit more selective of PDE5, and many documents out there say has a little less side effects than sildenafil. Now, tadalafil hits something known as PDE11, can inhibit PDE11, again, guys, by accident, sort of, right? Not ideal, just happens. It's a side effect. And that is why some men probably can get joint pain and muscle pain. Now, guys, if you're serious about treating your erectile dysfunction, then you need a serious company, one that is not trying to put you into a stupid subscription or shows you stupid advertising. I encourage you to click the link below. You can see the treatment options that we have at shamelesscare.com. Now let's talk about food because this really impacts people more than they think. There have been a lot of people that thought sildenafil and vardenafil was not working for them, but it's because they didn't understand this very thing. Guys, food heavily impacts sildenafil and vardenafil. The FDA has defined what is known as a high-fat meal, and these drug companies have to test their medications, the absorption, etc., if the person eats a high-fat meal. Now, what the FDA has decided is a high-fat meal, I would just call a meal. If I'm going out to a nice restaurant, I'm getting the steak, I'm getting the mashed potatoes with butter, I'm getting the salad dressing, I'm going to cross this high-fat threshold by a mile. You probably do as well. There's really not as much fat as you might think in what the FDA has decided is a high-fat meal. But for sildenafil and vardenafil, it blunts the effect of the medication. And it also takes longer for the medication to begin working. So if, for example, 50 milligrams of sildenafil typically works for you, but sometimes you've noticed that it doesn't, think about what you've been eating around the time that you tried to take the medication and around the time that you tried to have sex. Think about, I wonder if food did impact it. And by the way, guys, I'm going to be making a video about food and ED medications because this is so important. If you have ever noticed a difference in what you eat and how your medication works, please leave it in the comments below. First of all, I respond to all of those, but I'm also going to use that information in that next video. For tadalafil, the good news is food doesn't really seem to impact tadalafil to any sort of meaningful degree. So food impacts sildenafil and vardenafil, not really tadalafil. If you remember earlier in this video, I said that we offer sildenafil and tadalafil. We do not offer vardenafil, and part of that reason comes down to price. These are the prices at Cost Plus Drugs, which are essentially wholesale pricing. And you can see that vardenafil is multiple times more expensive per pill than sildenafil. It is much more expensive, generally speaking. Yet, if you've paid attention throughout this video, by now you've noticed that sildenafil and vardenafil, from a practical point of view, from how men seem to experience it, the timing, food, all of these things, they seem to be fairly similar. And so that's really why we've chosen not to offer vardenafil. I couldn't really think of many men that are seeking it out, and it costs much more. But for those of you guys that are taking vardenafil, also known as Levitra, and you think I've missed the mark on this, that it's much better than sildenafil for you, please let me know in the comments. But basically, it's much more expensive than these other medications. Since we're talking about 3 ED medications, it reminds me of compounded medications, guys. And you know I'm always going to give you the truth about these things. I will cut off my nose to spite my face or spite my face to cut off my nose, whatever. I'm completely transparent, and I just really want you guys to understand this, okay? Compounded medications in the ED space, instead of the little generic tablets, which we've been talking about today, like you go get a tablet of tadalafil or a tablet of sildenafil, this is when a compounding pharmacy mixes several active pharmaceutical ingredients together to make a troche or something like that that dissolves under your tongue. You've seen these advertised, Rougiette Ready, Blue Chew Gold, etc. We even have them, okay? But what you need to understand is, for example, some companies are now offering compounded medications with sildenafil and vardenafil together, even though they're very similar. They have similar side effect profiles. They last a similar amount of time. I can't personally think of a really compelling reason to put those two together, but they are. And I'm not saying there's anything wrong with that. The learning objective here, guys, is when you see ads for medication, realize that the names you see and the name brands that you see, completely pointless, completely meaningless for the most part, okay? Those are just made up names for recipes of medication. What you really need to hyper focus on is the ingredients. So for example, if you see one for sildenafil and tadalafil, and it's called Alpha Male 9000, whatever, stupid name they have, right? Think about, do you need a medication with sildenafil and tadalafil together? Could that help you? Forget about the name brand, forget about the reviews, a lot of that stuff, not even true anyway. Think about what's actually in the medication. That is some of the best advice I can give you as just a telehealth insider. Well, my name is Robert from Shameless Care. Thank you so much for watching, everybody, and we'll see you in the next video.